Senator Abeler offers the A50 amendment. The Secretary will report the A50 amendment.
Senator Abeler moves to amend Senate File Number 3769 as follows. Page 1, after line 11, insert. This is the A50 amendment.
Senator Abeler, to your A50 amendment.
Thank you, Mr. President. I admit this may broaden the focus of the bill, but if it's about helping hospitals, at least I'd like a chance to describe it, and then we can haggle about if it's germane or not. But the HCMC and our safety net hospitals are fundamentally important to the welfare of our state, and they are at risk. I hear over and over that HCMC is going to close in June if we don't do a 1% sales tax. Mr. Chair, I don't even think that's a reasonable idea to add another 0.85 onto the Minneapolis nightlife or to the vendors there who are already struggling and property values are going down. So I think we need to find a better way. And this is my very crude option, very crude start to the discussion in a public way. I read in the paper, the only plan is that one. And so I know people are working on things, Mr. Chair, Mr. President, but this is something that's concrete that says we had better weigh in. And so there's three parts to this in the ways it would help actually every hospital that takes any large amount of Medicaid. One is it would increase the rebasing, which is the rates that we pay for Medicaid, which are years behind and are part of the reason for Hennepin counties and North Memorials and Regions and Alina and those companies that take a lot of Medicaid clients, and they should be able to be paid for what they do. They can't work below cost forever. The second is this suspends the hospital surcharge for 2 years. It doesn't make sense to subsidize a company that you're actually taxing. And so it's like a 1.2% or so, and it's worth about $230 million in the first year. Now, this would need to be fleshed out, and this bill is going to go wherever if it happens to go on, and I'm not sure it will go on today, Mr. President. But it's a discussion we need to have as a Senate to create a Senate position. How are we going to help these folks? There's talks about uncompensated care pools. There's talks, community benefit. There's talk about that we really need them to stay around. But I think the message of this amendment I'm suggesting from my point of view is this is important to every Minnesotan. And I think while we shouldn't be spending much money at all, this is a place to dip into the till as a state and decide how are we going to stabilize our hospital industries across the state. Not just in the Northfield we talked about, Mercy, all and up in wherever, greater Minnesota, St. Cloud. It's that big of a deal. And so, and then finally for HCMC, as I chatted with them, they could use some flexibility. And so what they're allowed to do in this amendment is that between the management, which is the commissioners, and the MNA, if they unanimously agreed to something, which is a high bar, then they would be allowed to get a waiver from the Department of Health. I can't give you an example that would be specifically, but I do know that the people that are leading the place and the nurses are very interested in patient safety and quality care and all of that. So, Mr. Chair, I don't know that this bill is ready, but I wanted to bring it forward today to tell the people in Minnesota who have heard only the 1% idea, which I don't think it'll pass this body, and I would gamble less than 1% chance to pass the other body. So I'm putting my effort into it and my commitment to help this happen. And Mr. President, I don't see anybody stand to talk, and I don't want to belabor the discussion, but this is really important. And without this, Mr. President, the industry, if HCMC closes, the load cannot be absorbed, or if the rest of them go. So we'll keep working on it. Mr. President, with that, I would like to withdraw my amendment. Thank you.
Senator Abeler withdraws the A50 amendment.